Welcome back to Random Tools in the OR. Today I'll be showing you different types of cannulas. Now we have two different types of cannulas. We have cannulas that are used to remove fat out of the body, and those are our liposuction cannulas. And then we have our fat grafting cannula, which is the reverse, and this is to put fat back into the body. So generally speaking, when we're talking about removing fat from the body, we have round or blunt tip cannulas. These cannulas are used to cause very minimal disruption or damage to your tissues. They're soft in the round, so as they get pushed through your fat, they move aside all the important structures such as nerves and blood vessels, and they only suck out the fat. Different cannulas have different designs of holes on them, so that fat can be either sucked from only one direction or multiple directions. And there are even some cannulas which are called basket cannulas. These have a kind of cage or basket shape around them. These tend to be sharper, and these are good for kind of pushing through or breaking up areas with more scar tissue. So this is definitely reserved for areas with thicker skin, such as your back, or for patients who've had previous liposuction and now they do have a component of scar tissue underneath their skin, and we need to kind of smooth everything out one more time in secondary or revision cases. When we're talking about using cannulas for injecting the fat, these are always going to be smooth, and the holes on these cannulas are much smaller because we want to make sure that each droplet of fat is as small as possible but with the greatest amount of surface area so that it can absorb oxygen and nutrients from the surrounding tissues while the blood supply grows, and this increases your maximum survival rate of the fat.